Good morning, everybody. Good morning, everybody.
Good morning.
There we go, right. So actually, Sue's told you my life. I think I'll get down and go home, but never mind. So it's an absolute honour to be talking to all of you and those online as well. How many are on Twitter? Come on, if this retired person is on Twitter, I want to see those of you that are on Twitter. Right. You'll see my Twitter handle up here, @Anionwu. But this week, just for this week, I am the guest curator of the NHS Twitter account. Not the policy side, but they allocate every week. I don't know whether any of you are aware of this. Every week they invite somebody from the NHS or patient groups, supporters, users, etc., to run their Twitter account. This year is the 40th anniversary of the Sickle Cell Society, and I was very honoured to be chosen to run the Twitter account this week. So if you could make a note of @NHS, just @NHS, just dip in and out this week and engage with what's going on, please. So, just see next. Well, you know, to follow Helen and others who said read. And really, if I was asked to describe my memoirs, I do say, think Philomena. Who knows of Philomena? Anybody from the Irish diaspora? No Irish people here? Oh, come on, get your hands up. Okay, thank you. So that's the Irish perspective, and lots of other perspectives. So think Philomena meets Barack Obama's Dreams from My Father. Have you heard of Barack Obama? Yes. So let's go. So my mother's family is the Irish heritage, and they came over, the immigrants came over from Ireland in the 1860s, 70s to Liverpool, where, as you will be aware, I'm sure, significant Irish heritage population. So I just want to, I don't know whether I can, is this? Well, the toddler is my mother, and she too, like her parents, my grandparents, was born in Liverpool. I hope through the imagery you'll see the impact of religion and Catholicism in particular. Let's move on. So this is my mother when she was 18, and a very, very bright individual, incredibly bright individual, and the first in her family to go to university. You can imagine, this was in the last year of the Second World War, and so there must have been absolute delight, and she won a prize in her first year, a prize in her second year at Newnham College, Cambridge University. Now, with a heap of midwives and midwifery related, what happened next? Come on. Let's have some shout outs. What happened next? She got pregnant. But don't you need somebody to do that? Who? It wasn't the virgin. I know we're doing religion, but it wasn't the virgin conception. She met my dad, yes. Did she get married to my dad? You don't know, some of you know. No, she didn't. So let's go back. This is after the Second World War, just after the Second World War. What were the mores of the time? What was the stigma associated with illegitimacy, single parent? Catholicism, think about that. And that's where the Philomena narrative really kicks in. Yeah. She got pregnant, and just put yourself in the shoes, I know that's what you all do, of my mother. She couldn't even bring herself to tell her parents she was pregnant. And now the family were living in Stafford, she was at Cambridge, she came home for the Easter holidays. She was 6 months pregnant, so she was quite short, like me. She was starting to show, she tried to hide it. My grandmother was making her a skirt and was doing the fittings and realised that my mother was pregnant. grandmother was horrified. I mean, I cannot describe from what I've heard the shock, the horror, the shame, this absolute stigma of this. What on earth? She said, "Are you pregnant?" And my mother said, "Yes." So my grandmother was really angry. She said, "Well, when were you going to tell us?" My grandparents. My mother said, "I wasn't. I was going to go down to the river and jump in and kill myself." Because she could not, she knew everybody's dreams, aspirations, including her own, had just collapsed. My grandparents basically shut her in the house. There was no question of her going outside, because one of the incredible worries they had was that, God forbid, that the neighbours should find out that their daughter was pregnant. Now, this is where the narrative really differs from the experiences of women like Philomena, in that my grandparents did not kick her out the house. As I said, they shut her in the house. But they were devout Catholics, absolutely devout. My grandmother went to church every day. And as a result, they really did know their local parish priest. And it was to the parish priest that my grandfather went to for help on a variety of issues. The first was, is there any way that they could organise for my mother to go into a mother and baby home far away from nosy neighbours in Stafford? And this was organised very quickly. So she went to Birmingham. Secondly, what were they going to tell the university? They told the university that my mother had had a nervous breakdown and that she was recuperating with relatives in Ireland. Okay. The Newnham College thought so much of my mother and thought she had a brilliant academic career ahead of her. She was studying classics, I think I mentioned. They said they were going to hold her place open for her, which was actually quite unusual in those days. So things were starting to look a bit brighter for the family. All my mother would say to my grandparents about the father of the child was that he was a fellow student at Cambridge University. Zilch, nothing else. Then came the debate that you will all be familiar with: what's going to happen to the baby? Because initially my grandmother was urging that my mother have me adopted. No way. This was when the obstinacy of my mother kicked in and remained, in fact, throughout. Then my grandmother thought, hold on, I know what we can do. Let's tell them, when the baby's born, I'll tell the neighbours, I'll tell everybody, it's my baby. It was, she was quite plump, my grandmother. All right, I know, you're getting ahead, so let's move to the day when I was born in Birmingham and my mother took me back to the mother and baby home. And my grandparents were coming to see my mother and me. The mother and baby home was run by Irish nuns. And as my grandparents apparently were walking down the corridor with the nun, they got to the room, but the nun barred their way, turned to them and said, to be sure, the baby's a little dark. As the expression goes, I can only imagine what. Now, one of the reasons that many friends and colleagues urged me to write my memoirs was that I actually ended up being in care for 9 years, the first 9 years of my life. Well, the first 6 months, my mother looked after me in a mother and baby home. It was supposed to be just for a few months before the Catholic Church organised a cot for me in the residential nursery. But you have to remember this was just after the Second World War, and if you know your history, you'll know that there was a huge, huge upsurge in the births of babies to unmarried mothers. Now, it impacted on all organisations that were running children's homes, but I'm just going to talk about the impact on the Catholic Church, because this is Birmingham with a significant Irish population, and the diocese was the whole of the West Midlands. In addition, Irish women, sort of going through similar experiences that Philomena went through. Philomena, if you remember, was just, kicked out of her home in the early 1950s. So a lot of Irish women were coming over to cities like Birmingham. So the demand for cots in children's homes was huge. And as a result, that's why it took 6 months in all to get the cot. And I think that, well, it's not I think, we know that bonding will have taken place. And it was as a result of this that my mother decided she wasn't actually going to go back to university. But let's talk about what did happen. I went into the residential nursery, and it was all thought that this was going to be really short term. My mother would go back to college, complete her degree, and then would be in a position to look after me. But as I've said, my mother changed her mind, and that caused furore, just everything. She was sent to the canon. I mean, those of you that know the Roman Catholic hierarchy, we'd moved up from the parish priest to the canon. La-di, la-di, la-di. And the canon was asked by my grandfather to put some sense into, my mother's head and tell her to go back to university. My mother refused. She decided that she would not have an academic career, and it wouldn't be open to her as an unmarried mother. And she wanted to be a journalist. That never materialised, but she took secretarial course. Come back to what happened to her in a minute. So this was why, though, I ended up in care, and it just went on, and I moved from the residential nursery to Nazareth House. I'm sure many of you have heard of Nazareth House convents. And on the whole, I was happy there, really on the whole. It was where I decided I wanted to be a nurse, because I had very bad eczema, and there was a wonderful, I called her the white nun. They were all white. But this nun, unlike all the others, wore a white habit, and I discovered later she was something called a nurse. And I wanted to be like her. Why? Well, she was fantastic. The black nun wore the black habit. If I saw her in sickbay when I went for my treatments, which in the old days was coal tar paste, bandaging, which was lovely and cooling, but then it would dry, and the other nun, she would just, I don't think she was deliberately being cruel, but she would just tear the bandage off. The skin would come off. I would be screaming. So this is where I learnt to be a good athlete. I would creep round and have a look in the sick bay and see who was there. If it was the black nurse, ba-doink, I was off. No, and they couldn't catch me. They gave up. Fortunately, most of the time it was the white nun. And what she used to do was what we would call, I've forgotten the word now. Distraction therapy. This is called senior moment. Stay with me. She would use distraction therapy. So I'd be sitting there, and she would just be talking to me, and then she'd use really, what I thought as a small child were really rude words. Don't forget, this is, we grew up in the convent being taught that nuns were the brides of Christ, really holy, holy women. And to hear her then use a word like bottom, well, I burst out laughing. The bandages were off. I didn't feel a thing. I just thought she was the most wonderful woman on this planet. So I did Irish dancing, think of it. And I did actually, as I said, overall. However, there were some negative aspects of my experience. I gradually realised I was the only child of colour, and I washed my face 10 times with red Lifebuoy soap. Don't ever do that if you've got eczema. Don't ever do that anyway. And what was all that about? I think you can just realise what was that about. Then there was a time when one of the really nice nuns organised a little drama for all the kids, and she chose a few of us. The theme was nursery rhyme characters, and she chose me to be Humpty Dumpty. Oh, bit of a show off. Oh, I was so proud. But another nun came along. She can't be Humpty Dumpty. She's half caste. She's coloured. You tell me, what colour is Humpty Dumpty? And even as a child, I knew this was illogical. But I also had learnt as a child, don't get in. And also, it was really interesting. You know, you've been at a tennis match or you're watching tennis. Tick, 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 tick. These two nuns were arguing, and they were arguing about me. I'd never seen nuns argue before. Aye, this was fun. Anyway, good thing was the nun who wanted me in won, and I fell off that wall with aplomb. The worst experience I had, and this has been resonated in other narratives that I've read of children brought up in Nazareth House convents, was if you were a bedwetter. Horrendous. Your bed would be inspected in the dormitory, you wet the bed. I was a bedwetter. We were taken to an area. We were told to stand, each of us stand on a little chair. They would drape our urine-soaked sheet over us. They would tell us to put our arms up like this. There was a nun on the other side of the sheet. If your arm went down, which is going to go down, with the ruler. Now that, even as a child, I just think this it's horrendous, and that has stayed with me forever. Let's move on quickly. How am I doing time? Now, I reached the age of 9, and by this time my mother had married an English white gentleman, and I'm giving you the background, you'll understand in a minute. And my mother had got his agreement that if they did get married, I would be brought into the home. My mother always really just wanted a home for me. So they got a council house in Wolverhampton, but my stay only lasted 20 months. Why? Well, my stepfather drank a lot. He was being teased by his mates down at the pub. What are you doing allowing your woman to have a half-caste child in the house? We're now in the 50s, by the way, mid-50s, just for the historical context. And when my mother wasn't around, he started to physically abuse me. Initially, it was a sort of tap here, a whip with the dishcloth or things like that, and then it built up. And it was worse, of course, when he was in one of his drunken rages. And one day, he hit me so hard that I flew across the small front room and hit my eyebrow on the hearth. That is like metal. It burst open, blood, pain again, and I screamed, and my poor mother came running from the kitchen next door. And that was her first realization of what had been going on, because I didn't say anything to my mother. You don't sometimes. And she was absolutely distraught. Now, at this time, you've seen my grandparents were, in their own way, very supportive of my mother. But they become estranged because my mother had married a Protestant. That was a step too far. My grandparents had moved from the Midlands back up to the northwest, to Wallasey. And my mother went out of the house. There was no phone in those days in the house. Went to a call box and rang my grandparents, and they rescued me. So I went to Wallasey, and I spent a really pleasant adolescence there. Can you note, I don't know whether you can see how many of you remember those long photos? That's just a third of the photo. Can any of you that are close that haven't seen this photo before notice anything in it? All white, yeah? I had a whale of a time at school. I actually seriously do not have any negative, really negative. You have the odd one, but not to do. I just enjoyed myself there. This could be a slide presentation about hair. Nobody knew how to deal with my hair as I was growing up. They didn't realise that the tiny English, well, I shouldn't say English, well, yeah, let's say English comb, and we're not even talking about the knits comb, forget that. The ordinary English, they didn't realise that my hair needed to be greased, oiled. So again, if I saw the comb, I was off. And so the poor nuns in the convent, what they would do is get a bunch of my hair in the middle. I mean, they were really trying to, and put a big red bow, but they would do it so tight. They thought that my ribbon was always coming out because they didn't do it tight enough. Actually, it was the minute they turned their back, this ribbon was off. So they did their best, but some of us call that nappy hair. Okay, let's move on. I did enjoy school. I did well at school. I got 7 O-levels. My grandfather died after 20 months. I was very close to him, and I was actually very close to my grandmother, but as she was getting older, she was getting forgetful, and she could be quite awkward with me, and that's my aunt, my mother's youngest sister, who lived there as well. And she also said my grandmother was quite unfair towards me. I think what was going on was my grandmother was being overprotective and wouldn't allow me out, was petrified that what happened to my mom would happen to me. Anyway, to cut a long story short, she suddenly sent me back to my mother and stepfather. I was in lower sixth. I'd just been there a couple of months. Loved it, absolutely loved it. So that was another traumatic episode. But I got a job straight away in the Midlands as a school nurse assistant, and I was applying to 4 London teaching hospitals to study nursing. We're now in 1963, 64. All of the teaching hospitals asked for my father's surname. I didn't know it. I had my mother's maiden name. All of them asked for my father's occupation. And a clue, nobody talked about my father as I was growing up. And they asked for a photograph of me. Now, I put it to you that one or all of those factors was why none of those 4 London teaching hospitals ever replied to my applications. The medical officer of health who I worked with, who was really saw something in me, was horrified, gave me the name of another hospital, and I got in there. So I hope you've found me in the photo. Yes, good on you. Now, I was never taught about Sickle, and you realise the impact this had on me later. I've never taught about it. This was the classic textbook, 1965 edition. If you look quickly down the index, Sickle is not featured in it. Neither did they teach me about, or any of us, about Mary Seacole. And when I did find out about her, read her autobiography when it was brought out again in 1984, can you imagine my horror to find, well, I was pleased the editors brought us up to date. I found she's buried literally less than a quarter of a mile from where I trained as a nurse. Now, yes, of course we were taught about Florence Nightingale, and so we should have been. Why weren't we taught about Mary Seacole? So, yeah. Notice the hair? One of my friends in my student nurse cohort, a Jamaican friend, saw the difficulties I was having. I think it was my second year of nursing. Student nurse, saw the difficulties. She said, right, come on. Frog marched me down the Harrow Road or somewhere down there in the Paddington, took me to a West Indian hair salon, plonked me down, and I had my first straightening of hair. It was burnt my scalp. It was very expensive, but I thought I looked beautiful. And I was really happy. So this is just as an illustration. Now, I've got a chapter in my book called Becoming a Nurse But Not a Midwife. What happened there? I went up to the Simpson Memorial Pavilion. Anybody? Oh, I wondered when you said Edinburgh. Yeah. Now, we're talking 1969/70, and it was the first integrated course that they ran. Do you remember that it was part 1, part 2? And I loved midwifery. I can't tell you, I absolutely adored it. But I had a horrible experience. It caused me to become depressed. There was a midwife sister running this postnatal ward. There was an elderly primip, she was in her 30s, God help us, you know. And she had really struggled with getting the baby to breastfeed. And I remember I had helped her as much as I could, and it was successful. And unfortunately, she developed puerperal psychosis and was transferred to a local small psychiatric unit. Husband was a journalist, and he contacted me, and he knew I'd got on very well with his wife. And he said, look, she's a lot better. She'd really like to see you. And I thought, oh, fantastic. So I went off, had a nice time. Unbeknown to me, this harridan of a ward midwifery sister on the ward I was on had a friend working in that unit who relayed back to her that I'd been to visit this woman. I was called into this woman's office. How dare you? She just went off on one. And I said, but the husband, she just interrupted me. And I knew it wasn't worth talking to that woman. And I became so down, I can't tell you. And I was walking down the corridor, and the matron of she's very well known. Was it Maggie Miles or she was really well known. She just stopped me in the corridor. I didn't know who she was. She said, Elizabeth. Elizabeth, how does she know my name? You know, she came and talked to each intake, but come on, do you remember as a student, this high-level person comes in and goes, and she goes out and you go, Didn't even. So she stopped me, she said, what's the matter with you? And she recognised in my face. I just burst into tears in the corridor. She said, what is going on? You come with me. She took me to her office, made me a cup of tea. I'll never forget this, ever. She said, what on earth is going on? And I poured my she said, right, first of all, you were right to go, I will sort that. I thought, oh, great. She said, what do you actually want to do? Because I was saying, I don't want to carry on. So I said, well, do you want to practice as a midwife? And I said, actually, no. But do you remember, I don't know, it doesn't happen now, I don't think, but you did your state registered nurse in those days. And then you did midwifery with no intention necessarily of practicing. What a waste, you know. But that was so I said, I want to be a health visitor. So she said, well, look, you've got enough time you've completed your obstetric experience required to do that course. I'm going to give you a really good reference. What do you actually want to do until you get on the course? Because it was nearly a year. I said, actually, I love French and I'd like to go to Paris. She said, you go off to Paris. I said, there's a job advertised. I used to go to the Institut Français to keep my French up in Edinburgh. And I'd seen this advert for a job. She said, well, let me know if you get it. She was the first person I told when I got it. I mean, just capture that. See the impact we all have if we can. So, have you seen me with my posture's dreadful there, isn't it? It's no wonder I've got a bad back. Actually, it was due to having my daughter. It's not her fault. I will not name the hospital. I was supposed to be a trial of labour. They said, right, you're going to need a section. Couldn't find the anaesthetist. Let's just forget that now. 23-hour labour. Low back problems to this day, but never mind, on and on. So that was, but I loved the bit of midwifery I did. So I went to Paris very quickly, and this is where I woke up to my identity. I then realized I had a French African midwife that I became friendly with. She said to me, Elizabeth, over coffee, you read a lot, I notice. Who do you think was the worst or best colonizer, the French or the British? What? She said, well, you've obviously been taught about this in your school. No. I told her about washing my face 10 times. She said, the book you need to read is Black Skin, White Masks. The title says it all. by Frantz Fanon. I read that book. It's a bit tough initially, but then you really get into it. The scales came off my eyes. I realised I needed to sort out who I was. I needed to find out about my father. These are other pictures that just show you I was really becoming politically involved. Let's move on. So I wrote to my mum, still living in Wolverhampton, and I said, I'd like to meet, tell me about my dad. So immediately sent me the details that he was with his name and that he'd returned to live in Nigeria. I didn't do anything with this information for 3 months because I didn't know any Nigerians, couldn't even pronounce the name. Then I discovered that one of my friends taught Nigerian law students, the late barrister QC John Roberts, and I showed him the name and he said, look, I'll show this to my law students when I next see them. By the way, I'm now a health visitor. We've hit 1972. I was a health visitor in Brent. And so I left it with John. It was a Monday evening. Wednesday morning, John rang me at the clinic. He never rang me. You all right? I've spoken with your father. What? What, in Nigeria? He said, no, in Palmer's Green. Let's move on very quickly. I know time's going on. So this is my father, and it's mini-me, isn't it? It's little me. And so there's a little synopsis of what happened to him. And I love my Irish Catholic family to bits, but look who got to meet the Pope when he was presenting his credentials as an ambassador for Nigeria to Italy. And that's some snapshots of my family from eastern Nigeria. And I only knew my father for 8 years. Sadly, he died very young. But it was a wonderful 8 years, it really was. And he was the first person to sit me down and do career advice with me. My mother was absolutely gobsmacked. I mean, she never thought I'd find him, you know. She was worried initially when she knew I was wanting to find him. But I think that was a mother's instinct. She was fearing rejection, possibly, I don't know. But she was delighted that it all went so well. And so this is actually the last photograph of me with my mother before she died, literally a few weeks later. Now, let's talk about President Obama. And really why I link it with this book is he discovers through somebody telling him that actually he really is angry about things. He hadn't really recognized that. You know, for his upbringing, you'll understand. And I've realized that I was carrying a lot of anger in my belly for all the issues that just touched on some of them. And so in the book, you'll see that I talk about really what was good for me was that I channeled my anger positively in campaigning, political campaigning. Channel your anger. I think we've had some excellent advice early on. I don't need to say any more. Come on to Sickle, and the situation in the 70s was dire. And I'm just showing you some headlines from the Voice magazine. I was fortunate that I was now a community nurse tutor at the Central Middlesex Hospital in Brent, and I met Dr. Misha Brozovic, a consultant haematologist, and we really hit it off, and she taught me about it. And this is actually the only slide with a lot of text. This is what was making me angry in those days. I got interested in Sickle for two reasons. As a health visitor, I came across families on my patch, in my caseload who had children with the illness, and I didn't know anything about it, and I felt useless. I felt angry. Why didn't I know? Other colleagues had the same issue, broader. Let's just pick on, there was no, look at the situation for the families, which is similar, I know, for many families with illnesses, chronic illnesses. This is a genetic condition. But there was no routine informed screening of pregnant women. And there was no organised genetic counselling service. And I know Public Health England, I saw, are here. Please go to their stand, because they've come up, they're doing some wonderful work on, as you probably know, antenatal screening and screening the newborn. So I happened to go to the States, and I came across an African-American nurse who was a sickle nurse specialist. I didn't know nurses could do this. I thought it was haematologists and paediatricians that specialise in it. I wow, this is something I could get involved in. And this is what happened with working with Dr. Brozovic. I became the first sickle nurse specialist in the country in 1979. I've always had one foot in the community and one foot in the NHS. And hair? Happy about the hair? Don't we all look young there? And you've heard reference to collaboration with people like Professor Carl Atkins, sociologist, where we look back at what brought sickle and thalassemia onto the NHS agenda at last. And so that 16-year-old girl became a professor of nursing, who knew? And then I set up the centre, and I called it after Mary Seacole, because here we are now in 1998, and still a whole heap of students didn't know about Mary Seacole, and a whole heap of nurse tutors didn't know about Mary Seacole. And you probably realise now I've got a weird sense of humour. I thought, if I call this centre after Mary Seacole, people are going to have to say, who's she? And it worked. And all you need to know about Mary Seacole, if you don't know anything about it, is that this was a war correspondent in the Crimean War in the 1850s for the Times newspaper, who admired both Florence Nightingale and Mary Seacole. And of Mary Seacole, he said, I trust that England will not forget one who nursed her sick, but she was forgotten for over 100 years after her death in 1881. And it took 4 women, black Caribbean women, to approach their local MP in West London in the 70s or 80s, Clive Soley, now Lord Clive Soley, and they asked him to come to her grave in the constituency, clean it up, and asked for his support in getting a statue. And he promised when he had the chance he would do that. And he set up the Mary Seacole Memorial Statue Appeal. And as you've heard, and I hope you know, that it took us 12.5 years to raise £750,000. And it was unveiled in the gardens of St Thomas's Hospital by Baroness Floella Benjamin of Play School fame, in June 2016, so we're coming up to 3 years ago. And this is actually my granddaughter. She was 11 yesterday. Happy birthday to her. And I think this says it all. We went down, she was at the unveiling, but a few months later I was looking after her, and it was beautiful hot weather. We went out down to the Westminster area to see. I said, is there anything else you want to see? Can we go and see Mary again? And I managed to snap that photograph, and I think it really does say it all. How many of you watch Casualty? We're at the end now. Is that all? 2 people in this whole room? Oh, come on. Thank you. My daughter is the feisty nurse Louise. Oh! Now you've woken up, haven't you? And my nephew is Charles Venn, Casualty and Strictly. Now you've really woken up, haven't you? So that's actually my claim to fame. As you've heard, do you like the outfit, the gele? And yeah, it was a real shock, but yeah, I got a letter, would you like to be a dame? Yes, I would like to be a dame. And so, thank you very much for listening.